Hey everybody, it's Dr. V from the Veterinary Telemedicine Facebook group, and I have a whole group with me tonight, which is great. We haven't done this before, so this is going to be super. We have Ryan Hare, Dr. Amy Nichols, and Amber Sicko from All About Animals, which is in Warren, Michigan. Is that right?
Yes. Yes.
Okay, awesome. So I don't even know who to throw it to first, but I was just hoping you could start because, Ryan, you've been giving so much great input about how you guys are using telemedicine with your organization. So can you just tell us a little bit about All About Animals? I looked at your website. It is a substantial organization. Yeah.
Yeah, I love what I do. It's an amazing organization. Both me and Dr. Nichols have worked together for a few years now. We both previously worked at Detroit Animal Care and Control. So we have a very unique perspective in regards to working with clients who come from underserved communities, things like that. So we have a low-cost operation, both a surgical center as well as a wellness clinic. So when all this started, there was some concern, especially with the clients that we serve, being able to continue being provided care, in a affordable way. So Dr. Nichols came up with the idea to, look into the potential of launching a telemedicine platform. And Amber said, yeah, let's look into it. We started doing some research, narrowed it down to a couple options. We ended up deciding to go with the Televet platform, primarily because it's very user-friendly, pretty straightforward. So far, I don't think we've really had any issues from clients using it. Pretty simple. So it's been wildly successful beyond, I think, any of our expectations so far.
And so you have your clinic, which is for people that have owned animals. Are you also using it with pets after you adopt them to kind of reach out?
So yeah, we would. Unfortunately, we haven't had any of our adopted animals that have needed any services in the past 2 weeks now, but we were able to do just like a surgery recheck for one of our surgery patients. So that was great. But yeah, primarily it's been compliance. We do have some pretty lax VCPR laws here in Michigan, but we also implement, very lax. Actually, there is none. But we also knew that we would need to establish something, on our end to be able to make sure that we are providing adequate and appropriate care. So we have limited it to current patients that we've seen at least in the past year, unless it's something that is pretty straightforward. We've loosened it up a little bit. We've taken maybe 2 new patients for I think it was ear infections, Dr. Nichols. Yeah.
So do you guys have like a list of conditions where you say, okay, I can handle this via telehealth versus you need to come in, or do you have somebody who's sort of assigned to make that call?
Yeah, we actually, before we went live with everything, we created a guide and tried to define as many specific issues for things that we could potentially treat, diagnose through telemedicine. So that's helped a lot, but we also knew that there would be certain things that would pop up here and there that we hadn't considered in the past, and sure enough, there was. But for the most part, yeah, we have actually did some of the numbers. I mean, in the past 2 weeks now, we did 27 consultations successfully out of 46. 2 are pending though, but 17 were canceled. Of those 17 though, 10 were referred to full service because they would have required a physical exam.
And of those that were successfully completed, do you have a general breakdown of what the presenting complaints were?
Oh yeah, I'm a data nerd. I have it all.
Yay! That's what we need. I need to present that to the California Medical Board at our next meeting.
So we had 15% of those were upper respiratory infections. Another 15% were urinary tract infections. We set up a nice little curbside drop box and lab sample drop box, as well as being able to arrange curbside medication pickups as well. So we've been able to still send urine samples out to the lab, stuff like that. Again, we had the one surgery recheck. We had two issues pertaining to diarrhea or loose stool. 11% of those were minor skin issues. 37% were ear infections. And then we did have one consultation that regarded it turned out to be a tooth root abscess, and then also an obesity consultation for a feline.
Imagine that.
Right.
So, Dr. Nichols, walk me through when you get that person in front of you, how are you structuring this examination so you feel like you get enough adequate information from them without being able to touch the pet?
So usually I ask for pictures to be uploaded or videos to be uploaded prior, because I feel like I can get a better view of the animal with a previously uploaded video or pictures, rather than somebody trying to talk to me on their phone and then trying to show me what's wrong with the dog. I've tried that a couple times and it really hasn't worked great. So now I've just been asking people to upload photos of the specific, issue that they're having. And again, we're not seeing necessarily like full body, things. A dog or a cat that I think needs blood work, we're referring that out. And then for me, it's just kind of a chat with the owner, just get the info on what's going on with the pet, how long it's been going on, kind of basics. Have they had an issue like this in the past? A lot of these ear infections are chronic, so, and then, getting them, everyone has been really happy and appreciative that we've been able to treat.
Yeah.
So.
Is this something that you guys foresee using in the same way after the COVID-19 pandemic has moved past us? You see it?
I would love to, especially because I think we're going to be going into some new kind of normal where, it's just going to be different. And I don't know how different that's going to be. It's hard to speculate on it, but yes, I think it would be beneficial for us to continue to use this to certain extents, especially if we're booked in the clinic and it's, I'm off and I'm just hanging out. I don't mind seeing cases, that's not I think it's a thing we can kind of work around and figure out how to still continue to use when we're back up and functioning.
And how is the client response been, I guess, if this is what I have to do, or are people like, great?
Yeah, no, it's been really, people have been really thankful that they've been able to talk to somebody, that we've been able to resolve issues, get them medications easily. I've only been having, pretty positive feedback. Even the people who we've had to refer out, nobody really has seemed angry or upset. They understood that their animal needed more than what we could do. And we have full service vets that are open that we know and refer to, and they know that we're referring to them. So that kind of makes it a little bit easier. So we can give those clients that option.
One of the things that I was really happy to have the opportunity to speak with you, because on the human side, one of the reasons that telehealth was adopted so early was because of the whole access to care issue. And you were able to really reach a lot of people who had maybe never had access to healthcare providers before. And I would assume that this is something that's going to be a really powerful tool moving forward when it comes to access to care with these underserved populations. Do you guys have sort of a gauge for that, whether you see this being a tool you can use to help even more people that don't traditionally come in for whatever reason?
Interesting question. And I think that maybe our population in Southwest Detroit that we service would be kind of the population to go for on that. And Amber might have some better throw-ins on this. But I think telecommunication might even then be somewhat of a challenge with that population as well. I know that transportation surely is. We have a big problem with that down there, but maybe Amber, you can chime in on that.
Yeah, so that's absolutely one of the reasons I wanted to get this going so quickly, because they don't have access to cars. They sometimes they're taking their cat on the bus to get them to our clinics. So yeah, I would love to see this used more in those populations. And the other thing that we're looking at is providing more full service type services long term, and this would be a great avenue for rechecks, I think, so people aren't dragging these animals all over the place, just to bring them in for a quick recheck.
Do you have any sort of gauge for whether the fact that you're offering a televisit maybe would even make somebody more inclined to want to do the visit, whereas normally you'd say, okay, come in, and then they don't because they don't feel like doing the follow-up? Do you think this is sort of an incentive for them, or do you not really have a feel for that yet because it's still pretty new?
We don't have a feel for that yet, but I think from what I've been getting from clients is that this would be easier, and I think we would see more compliance with rechecks if they were virtual like this. Absolutely.
And so this is top of mind for me because I just spent 90 minutes this morning on a phone call with the California Veterinary Medical Board, who, it's kind of did the opposite of your state and made telemedicine extraordinarily restrictive in the face of COVID. And one of the things that they said was, you can only use telemedicine if you already have a VCPR, but also you need a new VCPR for every new problem. So you can't even use telemedicine for a client you've seen a million times if they have a new issue, like, an ear infection or something like that. So for you, especially given the context that, you guys, it sounds like you're doing it mostly for people that you've seen before, does the fact that you've had a prior relationship give you a better handle on the big picture than you might have with somebody you've never seen before? Do you think that relationship, helps you in any other way?
I'm going to say no, because we're so high volume. I don't remember. I mean, granted, I've only been here since August, but I've definitely seen multiple people. And for me to actually remember who you are is very rare, just because, we see, Ryan could state you some of the statistics on how many people we see per day. And it's staggering. So I don't really think that plays into it at all. And I'm just as comfortable helping to or trying to make a diagnosis on a new patient as I am with one that I've seen before. Especially too, if it's been something like the dog's had chronic ear infections that have been treated in the past. So then I think the one kind of different thing is, like, between human medicine and us is our patients can't talk, so we have to rely, and that maybe that's why our physical exam is so big, right? Because we're listening to what the owners are saying and not what the dog or cat is telling us. So that's the biggest challenge, really. But most of the stuff we're seeing is pretty basic, simple medicine that can easily be addressed telecommunication wise and does not require, to go into a full service and put everybody else there at risk, everybody at risk.
That's the other concern that I've heard a lot of. For some reason, everybody's really focused on abdominal palpation, and you cannot do an abdominal palpation via a virtual visit, but for so many of these issues, like you said, you don't need that. And so, do you find, or do you feel pressured at all for these cases where there are many cases where they do need to come in? Is it pretty straightforward to you, like, okay, I can't handle this? Or for some reason, have you put yourself in an uncomfortable position where you made a decision that maybe you didn't want to, or is that something that
yes and no. So if it's really something that I felt like it truly 100% needed abdominal palpation, I have no problem at all, no qualms referring immediately. And then there's certain things where, upper respiratory, where I'm like, this could be a heart or a lung or a cancer issue, but let's try some antibiotics and see if that works on this dog, because that if it does and it's just a cold or an upper respiratory or a kennel cough, we're going to save that person a trip. And if it's not getting better, or if I always tell people, hey, if this isn't working, or if your cat's getting worse, please stop and, go to an emergency or go to full service, because something more severe is going on. So, that's been working good.
Yeah, and that's something that I think often gets missed in these discussions, is this stepwise approach that I think every practitioner is familiar with, right? Like, even if we had a coughing dog come in and see me at the clinic, okay, maybe I'll get to escort them, but they're not going to go for x-rays the first time in either. And so
right.
You always sort of set up this, if this, then that, and that communication itself is really, really important information. And if they're not coming in at all, then they're getting it from Google, or they're getting it from you. So,
right. And actually, the clients I've done this with have been really happy that we've just been at least willing to try something that might help their dog. And then they realize if this doesn't, that, they'll need to seek further attention. But I've been, again, getting positive feedback from these clients too.
So you said you had a staggering number of patients you see. Do you have the stats on that for Ryan? Because I think that would be.
Well, yeah, so at the end of 2019, we saw 50,000 individual pets just in the wellness clinic alone.
Wow.
Yeah, and then we did do slightly over 34,000 reproductive surgeries. And obviously with that comes a lot of the surgery rechecks that we also perform in the clinic. So, before a lot of this started happening, I was starting to break things down, looking at things from day to day. So, on a busy day, I would say anywhere from 90 to 120. And then slow day for us would probably be, maybe 50 to 60. That'd be a slow day.
Hey Ryan, do you have any data on how many patients we see for like minor medical issues versus just animals coming in for shots and heartworm testing?
So, I mean, with wellness, in terms of what we classify as extended versus like routine wellness, so updated vaccines, things like that, I would say our extended wellness visits are about 25% of those total visits. So yeah, it's about a quarter of what we see for updated vaccines and things like that, general routine annual exam stuff like that. So we do see quite a bit of the extended portion as well. It's not nearly what we see for the routine and the annuals, but with that number alone, that's still pretty staggering as well.
Yeah. Was there anything that really surprised you when you started offering telemedicine that you didn't like, something that was really cool or something you weren't expecting?
Well, I think like Dr. Nichols said, I was very surprised with the accepting nature of the clients. I mean, they were very happy with it. They were very embracing. And like Dr. Nichols had mentioned, when we do see some of these cases where we have to potentially look at the possibility that it could be something more serious. She has a phrase that I just love, like, well, let's at least buy them some time until they can get into a full service, so being able to offer that solution as well has been very big for them. And I've gotten nothing but positive feedback from the clients. They've been very appreciative. Honestly, I would say when we first started getting ready to launch it, my nervousness was not in any way pertaining to the platform, to the protocols, to the processes. It was really about, are we going to end up dealing with a lot of irate, upset customers or clients because, they feel this may be impersonable, or could there be potentially people upset that, we have to be honest with them up front and tell them, hey, we don't think this is something that we can handle via telemedicine. It probably is going to require a physical exam. I'm going to have to refer you to a full service. But no, actually, everybody's been great. They've been very good. They've been just happy to be able to speak with the doctors, with being able to have a solution just in general. And to the whole point of access to care, we, having focus on underserved communities, it's made things really simple and really easy for them. And I think that's a lot of it too. And, again, I really think that we will try to implement this even as, things get back to normal. It's been very efficient. It's been very easy. And I mean, for the most part as well, like today, Dr. Nichols had a client who, we got the consultation submitted under, it was the granddaughter. And, upon talking with the granddaughter, she had been at her grandmother's house, noticed the dog had a really bad ear infection. So we were able to do the consultation with the granddaughter, made the recommendations, diagnosis. I called the grandmother. She paid over the phone with a credit card, and her granddaughter was able to arrange to come pick up curbside for the medications. because grandmother is immobile. And when I talked to her on the phone when she was paying for the medications, she was very appreciative. I mean, so I would say that was my biggest surprise with all of this, was just how appreciative people have been and how understanding they have been.
Yeah. And I mean, to me, this is such an incredible tool to help people,
It is.
right?
Yeah, it's great. I love it. I mean, I would honestly say, again, I was very surprised with how successful this rolled out. I mean, with all credit given to everybody involved, I mean, it did take, I'll be honest, I was a little neurotic in the beginning, like trying to put everything together in terms of having in writing and, policies and protocols in place, and very nervous that we had everything perfect. And quite frankly, a lot of this really has been kind of learn as you go. I mean, again, we've been coming across things that we did not expect or that we did not think of prior, but it's worked out perfect. It's been great. So I'm very happy with that.
I think a common denominator that I've been hearing from our clients, and it's, not surprising and not surprising, is that they have not been able to access care from other full service veterinarians in the area. And so that's why, again, I like my option of buying people some time if they need to get in full service. If I can put them on an antibiotic, and it's going to temporarily help, even though I know it's not going to fix the problem, at least we can do that. And it, because it might take them 5, 6, 7 days to get into a full service vet, especially if they don't already have a previous relationship with them. So
it's amazing. When people, how do people get appointments? Is it all over the phone? Do you have an online submission? I'm wondering how it is that you actually convince them to schedule, because that's another thing people say, like, oh, we have it, but our clients don't want to use it.
Well, it's funny for us. What's nice is the Televet app. When the client downloads the app, they basically will create their account and then a pet profile. So from the pet profile, they will submit a consultation request that we then get notified about. Typically, I will pull, when we get the notifications coming through, I'll vet them. I will look at them, see, do we have a current relationship with them? And again, like I said, on 2 separate occasions, we felt comfortable enough to take on a new patient. They were existing clients, but with a new patient. And, so I'll leave some notes in there. So when the doctors start fielding the consultation requests, they have something to go off of. And, from there, the only marketing we've really done in terms of notifying clients is simply Facebook and our website. And like I said, as of today, we had 46 total consultations, and tomorrow will have just been the end of our second week. But we also did, I was curious to see as well, but we do have 150 clients and patients currently registered through the app as well. So wow. There's definitely really people cool. Out there that have signed up for it, and, expectation that, I'm assuming, intend to use it as well. So
yeah, I didn't realize that so many people were actually coming in through the app instead of through your clinic. I'm sure Telehealth.
Yeah. So we haven't had to tie up the phone lines or anything like that. They just submit it directly through the app. That's another reason why I like the Telehealth app. No, so yeah, we don't have calls into the clinic. So that's one of the features I really liked about the app. And we have both the mobile Televet for vets on our phones, as well as the on our computers as well, because with the Televet for vet app on the mobile phones, we can place the calls and do the video chats from our mobile devices, while being able to enter notes onto the desktop version and do things simultaneously and very efficiently.
That's the part that I think everybody's kind of getting nervous about, is, the workflows. But like you said, you just got to figure it out.
Right. Yeah, it's great. Yeah, we have, and we do have responsive hours that have been established. So we've said Monday through Fridays from 11 to 3. However, we are working on those consultations outside of those hours as well, whether it's, calling back clients to do payment over the phone for medications, being able to submit prescription requests. So we've been doing either our online pharmacy or curbside pickup, depending on what it is. I remember like the first week we had a cat Dr. Nichols prescribed like 5 prednisones for. So unfortunately, the online pharmacy, you can't get anything under the 30 count. So, you know, that was, you know, basically the beginning of us starting to realize, you know, hey, we can do the curbside medication as well. And, you know, it's been going so well that I quite frankly have been incorporating it a lot more frequently now as, you know, as well. So, you know, it's been pretty interesting. Like I said, it's been, you know, a day by day type of thing and learning as we go. But again, it's been very user friendly for the clients. They've had a really easy time getting it. And again, when looking at the access to care perspective, that was one of my biggest concerns was you know, we want to make sure we're looking at an app that is not going to turn people away, something that is not busy, that's not super complicated. And so this was our decision, you know, part of our decision for why going with the Televet app was important to us. And again, I mean, we've had many clients in age range, some that will tell you they are not tech savvy at all, but guess what? They figured it out and they enjoyed it. So.
Oh, that's awesome.
Yeah, and on a clinician's standpoint too, this app is very easy to use. I'm not a super tech savvy person. I really didn't even play around with it before my first client. And I was a little nervous, but I winged it. And after my first one, I was like, oh my gosh, this is so easy, and it's so easy to make notes in there and speak with the client. You can even chat with them just on a text message feed on the app, before or after you call, and talk to them if you need to do further communication. It's really simple and nice to use.
I found that the pet telemed apps are actually way more user friendly than the people ones. Like trying to go to my doctor takes half an hour to click through all the HIPAA stuff. So.
Yep.
Oh, right. We don't have that. Yeah.
So no regrets for you guys. You're happy you did this.
Absolutely. Yeah, I feel it's nice to just be able to feel like I'm helping people make a difference during this time, and gives me something to do during the day and still feel like I'm being productive and helping people. It's what matters.
Is there anything else that I forgot to ask that you just want to make sure people know, or an application I didn't ask you about?
No, I mean, I know we touched on the fact that, we're fortunate here in Michigan right now, from the BCPR perspective. And I know me and Dr. Nichols have, we've talked about California specifically, and, address the fact that we're very lucky.
Going to be the most regressive state.
Right.
That's got to be tough.
Well, thank you. I mean, thank you guys so much. Thank you for talking to me. Thank you for being true trailblazers in this, and for being models really for the rest of the country, because we all need to see successful examples like this in order to be able to implement this in backward states like California. So we owe you a debt of gratitude when we get there. We'll get there. But
you will.
In the meantime, yeah. Thank you again so much for everything, and thanks for taking the time to speak with us.
All right, you're welcome, and thank you for interviewing us. Yeah,
yeah,
fun.
Thank you.
Thanks for getting the word out. Thanks.